everybody. Welcome to another Pilates Hour. Really excited to be hosting again this week. Thank you all for joining. Today, we're going to talk about some home exercises. And yes, we're going to talk about the exercises, but we're also going to explore a little bit about why do we do home exercises? What's the point of them? Are they really accomplishing what we're thinking we're accomplishing? My big question always is, do the clients know what to do and how to do it? How do the clients know that they're doing it well for their body, that they're doing whatever it is that you as the Pilates teacher or therapist are giving them? And, can we be a little more articulate with them, and can we have a plan that's just not give people a couple of exercises and hope for the best, but a plan that takes them through those exercises and then on their whole journey, whether they're in physical therapy and maybe they're going to graduate and go back to whatever their sport is, maybe they are a Pilates client, so they're going to return to their Pilates practice. Maybe they're going to return to running or whatever it is that they do. We want to make sure that these things follow them, and not so much the exercises. And we'll talk a little bit about that. How and when do we progress? But to me, what's really important too is what's the ideas that we are giving to the client. And you've heard both Brent and me and probably other guests on the show talk about how important our vocabulary is and how we're saying things to people and working around what their beliefs are. So there's a lot to this topic than just a handful of what we sometimes refer to as pre-Pilates mat exercises or just home exercises. So like most days, we could have chosen any number of exercises. I chose these because they are both common in the physical therapy world of giving these particular exercises to patients, and they're also pretty common in the Pilates world and in just the personal training world. So these are the ones that I chose. And I've mentioned physical therapy a couple of times because I'm hoping we've gained some people from the physical therapy conference, the combined sections meeting that we were exhibiting at a couple of weeks ago. And I think there were 14,000 attendees. It's a very widely attended conference for physical therapists. And it's where all the different specialties or sections come together. All the different orthopedics and neuro and women's health and geriatrics. And so all the different specialties come together for this meeting. And we were exhibiting and had quite a good number of people come by the booth over the days, and really people engaged and wanting to know more about Pilates. I love it when they say, oh, my mom does Pilates, some of the physical therapy students, or I did Pilates at one of my clinical internships, different things like that. So I just love now going to these conferences, because back in the day, 20, 30 years ago, we'd go to a physical therapy conference and people were still doing what pilates? What is that again? How do you do that? And so we've come a very long way. So I'm hoping that we have some people joining that maybe haven't been joining the webinars, maybe don't know so much about Pilates, and can gain from some of this. So we're going to take a look at both femur and arm arcs. We're going to look at bridging, one of my favorite exercises. Side to side, this is sometimes in the physical therapy world called knee sways. In Pilates too, knees going back and forth. Let's bring some clarity there. The prone extension or the prone press up, or baby swan, sometimes people call it. A version of sideline, or maybe even we might get into side kick as well. And then quadruped. And as I said, there's so many others we could have chosen. This is what we're going to look at today. So again, with any of the exercises, I think we really have to do a little bit of soul searching as we're giving exercises as to what do we want out of people. Now, of course, this will be different for someone coming in with a very acute injury in a physical therapy setting to a Pilates client maybe coming in who doesn't have any major injuries or pathologies, just wants to do Pilates to get into better shape to accomplish whatever their particular goals happen to be. So we'll, have to keep that in mind. But we really want to work on, and you've been listening to the evolution of our Polestar principles. So the ideas of obviously breath, we'll certainly work on that. Mobility, alignment, control. Those are kind of the three big things that we're going to look at that. And then how does that integrate together? So we're going to look at hip and or shoulder mobility, depending on the person. We're going to certainly look at spine mobility and get as much as we can, depending on the person who's with us for that session and going to be our client or patient for a while. And then how do we control those things? So those are three things that I'm really kind of looking at in the beginning. And we want it to also, as much as it can, be spontaneous. So how can we improve control by being spontaneous? How do we do that? I'm hoping your brains are going, and so you can just kind of think to yourself, what do you do as a practitioner to look at those things? What do we do as practitioners to cue or get out of the way, and maybe don't cue so much, to get spontaneous movement? I think sometimes we do our best, of course, but we actually create a scenario where people, it's artificial. And of course, anything you first learn to do, Brent likes to talk about learning to ride a bicycle the first time without any training wheels, and you're gripping the steering wheel and your jaw is probably clenched and you're trying really hard not to fall down and you're wobbling all over the place. So anytime we learn something new, there's going to be a moment of a little too much muscle involvement, a little too much thinking, maybe over analyzing what's going on. But when then can we get into somebody moving, both having mobility and control, that's a little bit more spontaneous? So what I want to do is challenge you to all work on the words that you're choosing, the ideas that you're choosing, and moving a little bit away, as you know, from volitional muscle cueing. So there's just too many muscles involved in most of the movements that we're going to look at today to actually cue a muscle to do something, because we've then, by cueing just one, we've not cued the other 10 or 5 or 20 that need to be doing something at the same time. So we're moving away from that and creating a safe environment for somebody to learn how to move just on their own. So sometimes it's as simple as saying, let's say we're doing the femur arc, maintain your body in the position that it's in, right? They're lying down. They're either on a mat, they're on the floor on a mat, maybe they're on a trap table. They might be on a treatment table. They're not on a moving surface. So their body is pretty stable in a sense. It's not going anywhere. It's there. So what do we do then, in terms of that? So just maintain your body position and bring one leg to tabletop and place it back down. And you might think, wow, I didn't cue the breathing. I didn't cue the pelvic floor. I didn't cue the abdominals, or my favorite, the deep abdominals, or the lower abdominals. I didn't cue any of those things. And you're right, because it's probably not needed. I could cue any of those things if I felt it was really needed and going to benefit, but if it's not, it's not. So just maintain the position and lift the leg. And then bring some awareness to what happened. So are we really watching the client? And what does each client look like in that movement? It's not going to be the same for everybody. We might have people's position, their supine position, biased toward a little bit more lumbar length. I hate to say lumbar flexion, because we're probably not really putting the lumbar spine in a lot of flexion in supine, in a hook line where the knees are bent and the feet are flat position. But we certainly could be lengthening the lumbar spine. And just naturally gravity pulling our body down is also going to do that. So I try not to talk too much about flexion there, but more length. That might be more appropriate for somebody. Maybe somebody is working with stenosis or a spondylolisthesis that is aggravated or irritated. And so maintaining even their small lordotic curve is a little bit uncomfortable. So we could look at that. And let the client move and see what happens for them. And then ask them, hey, did you notice what happened? A lot of times they will, a lot of times they won't, and they can keep practicing it. Even if their body is moving a little bit while they're doing their femur arc, it's probably not going to be detrimental. Obviously, if they have something very, very acute, you might want to, maybe they put their hands under their pelvis or around the end of the pelvis to keep it in a little more steady position. That's all fine, because what we really want to do is get the body moving, the leg in the hip joint. So things like that, they're just really taking a moment to listen to what we're saying and figure out if for this patient or this client, are we really creating an internal association to the movement, an internal awareness. They may not get it yet. It may take several times of practicing it with them. This is where, it's great to grab their phone and record them. This is what I, want you to do. You can hear all the cueing. So it's a very quick way to let people at home know what to be paying attention for. But we need to make sure that we're doing that. As we go on, we'll talk a little bit about how we progress the client. So we won't touch that now, but that's kind of how I think about it, how I start. So some other thoughts. I get often asked about alignment, and when I'm listening to students teach, whether it's in our courses or in the studio, maybe they're practicing on their own, or we might be in the course where they are practice teaching. I notice that there is a big focus on alignment. And alignment's important. It is one of our principles, right? We talk about alignment, not only alignment of our body to other parts of our body, but also alignment within our thoughts, alignment in our beliefs. So it's even a bigger topic. But is micromanaging alignment really important? And I'm thinking right now about Juan Nieto. Many of you have studied with Juan or taken workshops or know Juan. And he often brings this up of maybe we're focusing just a little too much on this idea of perfect alignment. Because then that, again, is leading toward not being spontaneous. And you can watch athletes. You can watch, the next time that the Olympics are on, especially Summer Olympics, because we can see more of the body. Watch people running or watch people doing the different sports that they're doing, and their alignment, it's not perfect, but for their body, it's okay, and there's nothing detrimental about it. So yes, create change where there may be really an alignment that's not serving the person very well, but then you can let it go a little bit and let the person continue to move, and hopefully those two things will help each other. The more that they move, the better their mobility is, their awareness, and their control of the mobility, depending on their sport or their activity. Hopefully then that will also improve their alignment. Again, a little bit more spontaneously. So that's just something to think about alignment. I'm sure I'll get comments and questions about it, but that's okay. I like to put those things out there for us to think about. And the last little part to talk about before we start looking at some of the exercises is, are we really creating these scenarios where people can be successful? So I touched on that on the last slide. And again, thinking about our imagery cueing and our ideas around how we talk about the different movements of maybe being good or bad, or one of the things that I hear often, and I've mentioned probably in all the webinars because I think it's such an important idea, is this idea of being careful to the point of maybe getting the patient or the client to think, gosh, should I be scared in this situation doing this movement? Now you have to be really careful because you have stenosis, or you have to be very careful because you have osteoporosis. And yes, we do want to have care. We want to make sure that we are giving clients the right movements at the right time. But I don't think we have to really tell them to be careful, because if we're doing our jobs right, and if we're using, especially those of you that use the Pilates apparatus or other different apparatus, TRX and different things that have support and pulleys and ropes and different things where the body can be either suspended or assisted, I don't think we have to impart that little piece of being careful, because it always makes me think, well, what's going to happen? And then maybe my thoughts are on that as opposed to how I can do the movement well, especially if they're already having a good experience. You can still say, for you, you're going to, maybe again, we're talking about a pelvic clock or a pelvic rock where the pelvis is moving anterior and posterior when lying in supine. It's still okay to say and help to set some limits, kind of the co-limit setting between the therapist or teacher and the client or patient, of move until you notice such and such, or move until this happens, and then come back from it. So those types of things are good, and I think those are really useful because those are the little markers, the little things that our clients are going to remember when we get into it. They're saying, all right, now, they said to do this like this until this. I can do it as long as, let's say I'm doing femur arcs or arm arcs, I can do it as big or as much until I feel my ribs lift. And then I bring my ribs back down. So those types of helping them understand the limits, and those of you that are familiar with the stages of rehab from Porterfield and DeRosa, we've used it for a very long time in our teaching. The last part is setting limits. But I kind of feel like we should be setting limits all the way through. So from the very first day on, we should not be setting a hard, only do it this way, but here's how you know how much you could be doing it or should be doing it. And you've probably heard Brent talk about this too, because I think it's really important for the clients to be part of the equation and in control of their movement. Otherwise, we're just saying, well, just do 10 of these leg arcs and you'll be better and, see you next time. They have no idea what they're practicing. They have no idea how to do it. They don't know how much might be too much or too little. So I do think we need to spend a little bit more time with that. But just think about, are we really, if we could quiz, if the clients got home or patients got home, they did their exercises, and then they took a survey. If the survey questions were, do you understand the goals of the movements that you're doing? I bet they probably don't. So I think we can just do a little bit better job with that. And I invite you to, if you have a mat or you're somewhere where you have equipment or, wherever you have some space, if you want to do these exercises while we're talking about it, I think it's a really cool thing to do. If you can't, there's no problem. It's kind of nice to do them with as well, just to experience some of the cues, some of the ideas, and maybe some things that might be a little bit different for you. So first exercise I had on the list was femur arcs, could also be arm arcs. Just think to yourself, what is the first piece of information if you're going to teach somebody, right, if they're doing you're going to teach them to do this type of a femur arc, whether both feet start flat or eventually they have both feet up and we're doing it from here. What's the first thing that you think about? What's the first thing that you tell your clients or tell your patients to do while they're moving there? What's the first thing you say? And then what's the next thing you say? What's the next idea that you put in for them? And how much time do you spend getting them set up to move? Because I think that's important as well. And it runs the spectrum. I've seen practitioners set the person up for what seems like almost a minute. The person already doesn't really know what they're doing. It's maybe their first time with this particular practitioner. They're going to have to remember it to do it at home. There's so many things going on. And they've now just given them 45 seconds of chit chat about what the exercise is going to be. It doesn't necessarily set us up for a really good experience. So what are those things for you? And then we can explore what I would potentially say or do. Other things just to keep in mind: have cushions, have towels, have something to put the head up. Because if we really are looking at trying to get the neutral alignment, right? So the normal curves that this person has, right? Everybody's are a little bit different. What do they have? What's their body type? And then thinking about it with gravity pulling down. So the curves that you might see when somebody's standing up, it's going to look a little bit different when they're lying supine, when they're, being pulled down into the mat or to the table with gravity. So have something behind the head, because we tend to, nowadays, right, from our computers and driving and all the things that we do, our heads are a bit forward. And so to get our head all the way back at the same point to be in line with our thoracic spine, that for a lot of people is a lot. And I see people with their heads hanging back, and they'll say, well, how do I know? And I'll say, if it feels like you're falling over backwards, but you're laying on a flat surface, you should probably have your head up, right? Put it up on the reformer if you're using the reformer. Put it up with a cushion or a towel. But don't stop there. Work to take that thing eventually away, right? So again, we use things in the beginning, and then we just kind of get complacent. We forget that we want to progress people past having something behind their head. If they need it forever, they need it forever. That's okay. But how much change can you make, and how much can you decrease whatever you have behind their head? So the other thing I love to have, and I've shown this in other webinars, is just keeping a small ball around. You can get them, on the internet, little soft balls. Sometimes they are used for MFR work, for myofascial work, or just for props and different things. And this is a great thing to put behind the knee to promote a little bit less quadricep involvement in the sense of straightening the knee. So that's also very helpful when we're getting into our femur arcs. So once lying down, now we can explore just for a moment the idea of neutral, because the client probably won't know anything about that. They won't really have an understanding, potentially. They might. But moving around a little bit, again, avoiding any movements or positions that would be uncomfortable for somebody until they get to this point where they're in, a good representation of a balance of all the curves of their body. And then right away, I start to talk about hip mobility. I love to do all of the kind of the hands, describing the hip joint, my words describing this deep joint. And I'm always looking to make sure that they know where their hip joints are, not out to the side, but really deep in the pelvis and very central to the body, which means that it's quite easy to control this mobility that we have, because it's in, we're not having to reach out for it. And that's where we would go. And the place, if I see the arching of the lower back, because that's usually, if somebody, especially if they go to lift both feet, they're often going to start to allow the ribs, the spine, and the pelvis to move. And we have the arched position of the spine now, or extension. Then I come in and cue the ribs. Because if we can get the ribs to maintain their contact with the mat, or at least a light contact, then that's again something I can pay attention to as the client or the patient of, I see and understand now as I lift my leg, my ribs are lifting. And I can maybe use my breath or just a different focus of keep this down as the leg moves. And that then I've told the trunk to have control by keeping the ribs down. So I'm not too concerned with a lot of the rocking from side to side or things like that. The pelvis will move. And if we want to have normal gait, normal walking, our pelvis is moving while we're doing those things. So again, the idea that lifting your leg and moving your pelvis is wrong is probably not the best message we can give for this exercise. But we want to keep everything steady for this particular movement. But I would not go so far as to say it's wrong, because I want to see, when they're walking, I want some movement of the whole spine through the hip joint and into the leg, and let the body really find its way into that. I think that's an important piece. Now, what about those clients who maybe are not coming in with an acute injury? This would be somebody who doesn't have something really serious that they're working with right this moment, but they almost have kind of a dull sense in their nervous system. I always kind of think it's like the nervous system has kind of been dampened, or the gauge is turned down a little bit. Movement and things are happening. They're just not aware of it. So then what can we do? And this is where we can create, again, an environment where the body can spontaneously fix itself. So, and fix, I mean, like get it into the position and maintain it, whatever we want to be happening at that moment. So those of you that have been on an oov is amazing for this. A foam roller, a soft, squishy cushion, just lying in your own bed at home and practicing these exercises, you start to notice, oh, wow, things are happening. I wasn't aware of that before. Anything that you want to lie on that gives you that added amount of input back into the system. And sometimes clients just don't know, and we get so frustrated. It's like, how can you not tell that your hips are moving? You're lifting your leg and your body is twisting, and you're frustrated, they're frustrated. Give them something else. And, a lot of times, again, especially new teachers, they'll think, gosh, a foam roller, lying on a foam roller from head to pelvis, if the person can't do it lying on the mat, no way they could do it lying on a foam roller. But you would be surprised how quickly it brings the body back into kind of its own sense and really heightens the nervous system. It's able to take in these bigger changes in our body position. So create that environment and make sure the clients have those things at home that they can practice with as well. You can, always start with the legs a little higher, a little, the feet lower, the feet higher. How are they doing? If you have a little bit less range of motion, that's sometimes helpful. A lot of times on the oov, we'll be lying on the oov, and it's that kind of the blue piece. If you haven't seen it before, it's not really like a foam roller, but it's the closest thing we can kind of you can imagine it with. And you lie on it, it expands lengthwise and compresses a little bit, but adds all of this instability. So we'll sometimes put the foot on a box or a ball. A box is more stable, a ball a little bit less stable, and then allow the other side to move. Again, for that spontaneity, for letting the body figure out how to do what it needs to do. So those are all options. And then really thinking about, where are we going with this? So I don't want clients to do leg arcs for very long, right? Once they can do it, maybe they progress to being able to do both legs. Let them do it. Let them go on and progress. There's nothing worse than doing the same home exercise for months and months on end. They should be able to hopefully master it in a week or two. They should figure it out. And if they don't, that's okay. You keep working with them. But the moment that they're able to do it well, then add on and keep challenging and keep adding levels of difficulty, changes in choreography, changes in load. Now they're maybe moving with straight legs. If they have a Pilates mat program that they are already doing, mat classes, get them right into the mat exercises, full mat exercises, so they're experiencing the load, the tempo changes, all the different things that we can do to keep it interesting and continue the plasticity, right? So the brain is having to, do things to continue these exercises. The torso, the body, the limbs, everything is changing as we're learning. So make sure you're having that with it, because that'll be really important. All right, let's look a little bit at bridging. And one of the things to try with bridging, and again, if you are teaching quite often on the reformer, you've already figured this out, this idea of having the feet up higher. But if you only teach on the mat, or maybe you're teaching your personal trainer, or you are a physical therapist, giving people bridging as a home exercise, try it with the feet up. It will really help the client. And again, I mentioned the reformer. That's one of the beauties of doing bridging on the reformer, is because the feet are up so much higher. So find yoga blocks, find anything that's not going to be too mobile in the beginning. I do have my mat classes put their feet on a foam roller, so that's adds a little bit more challenge. But you can then get to the point of having the hips up and having a little bit more, I kind of think of it as more time and more space, even though we're ending at the same position. So for the bridge, again, starting in the lengthened position. And then one of the other things that I'm looking for from an outside view observing the client is, does the client slide toward their head, or do they stay in place or slide toward their feet? And this again is one of the benefits of doing this movement on the reformer. If you lighten the springs a little bit, not so light that it gives them a hamstring cramp, but if you lighten the springs a little bit, the initial movement that you'll often see is the carriage, the bed of the carriage starts to go out and they start to push back. Which again, in the process of learning, that's okay, that's normal, but we would like for the idea of it is to move toward the feet, lengthening that way. So we're not pushing. And we end up with this sense of tractioning of the pelvis toward the backs of the feet and then up the back of the leg, all the way to the back of the knee. And the stopping position, again, really important that we're trying to get toward or near a long diagonal. And a lot of times we end up something more like this, because I feel like I'm really doing well. I'm lifting my ribs up, I'm up in the air. My bottom though is hanging down, my spine is an extension here, and extension here, and I haven't actually gotten to the place where I'm in hip neutral. So think of bridging as a spine mobility exercise, a hip mobility exercise, and then a way to get to hip neutral for people. And again, it's not a requirement to get here, but that's the goal that we're moving toward as somebody is going into their bridge. I still hear a lot of a focus on lumbar flexion and getting the lumbar vertebra to touch the mat. And that's a long way. If we think about where the spinous processes are and how far away they are from the mat that we're lying upon. You have all the paraspinal muscles, sometimes just the tissue around the buttocks. If I literally push my spinous processes down to the mat, I have a maximum amount of flexion, and now I have a pretty rigid body. I am no longer supple, I'm no longer able to have the articulation that we'd like, because I have, again, thinking back to the earlier slide of, have I actually created a scenario or a way to move that's not helpful? It's not really serving the purpose. So we can let that go. It's a little bit of an antiquated idea. Yes, the pelvis moves posteriorly. Yes, the spine will flex a little bit, but not as much as we describe. So I think if my clients really listened to me and did everything I told them to do, would that be the right thing? And sometimes we have to, record ourselves and listen to what we're saying, because it's not so much about that. And I often use I have my origami spine. I also have my slinky that I always have with me. And it's the idea of parts of my spine lifting, and I don't know how well you can see it. It's probably not as visible. Maybe on here might be better. You can think of the vertebra as lifting as opposed to them changing their orientation. So there's really no need for the vertebra to change its orientation a lot. It's more just going to lift up, and it will tilt or incline a little bit, but not as much as we sometimes describe. So that's bridging. Again, I think it's a beautiful exercise, but sometimes we need to spend a little bit more time on it and really get the clients to wrap their heads around it as we're wrapping our heads around what's the real purpose of it. And totally fine to go past the neutral line. You know, sometimes people get a little fixed on that too. Once you get to the line of diagonal, you can definitely, if you want to go into a back bend, you would absolutely go into more thoracic extension and hopefully more hip extension as you go into your back bend or whatever exercise you might want to go on from there. So that's that. Going on, I'm just checking the time. Yeah, we're good. To a little bit of side to side or the knee sways. And this is, again, a really common exercise and a really lovely movement pattern for just getting a little bit of relaxation in the body. So I know when I've gone through times where I've had my own low back pain, the knee sways from side to side, a really gentle bit of rotation or oscillation is a really nurturing feeling. So I love it for that. But then can we go on with it? And I think it's important, if we're teaching this, is to educate our clients, educate ourselves on, are you looking for spine mobility and rib mobility and rotation, or are you looking at hip joint mobility? Or maybe a little bit of both. But be clear with that as you're teaching it. So what really is moving? Where is the movement happening? And where is there not so much a movement? So in thinking of the knee sways, or the side to side, as we often call it in Pilates, of just letting the knees go, that's more of a relaxation part. My feet are staying down. I'm not being very technical with what's happening. My upper body is staying down, but just by nature of it being there, I don't have to really talk too much about that. Until we get into then wanting to have a little bit less movement at the hip joint, the sides of the feet staying together, the inner legs staying together. And as my knees tip to the side, you can see this foot comes up, my feet stay together. And now I'm really much more focused on rotation of the spine and ribs. There's not really much happening in my hip joint. So again, thinking of the wording that we're using of moving the pelvis as opposed to talking about the hip, because people will associate that with the hip joint. And there's really not movement at the hip joint. The movement is in the spine and the rib cage as we're going back and forth. So just thinking of clarity there. But also it's the side to side motion of the pelvic rock or the pelvic clock, where now I am having a little bit of rotation in my spine and also some movement in my hip joint of this reciprocal movement. Again, just like we would be doing a very similar pattern to walking, right? Of moving the pelvis, the spine, the legs in this way. Going on to our side kick, and before side kick we have side lying. And again, this is just femur arcs lying on your side. There's no real difference other than now gravity is acting on us in a different way, and we're in a little narrower base, so we don't have our whole body down, shoulders and pelvis. Now we just have one shoulder and one side of the pelvis down and the knees bent. And so the same idea of what would you cue first? What is the thing that, I'm just going to move my hand out of the way so it doesn't get in front of the body. But what do you say if you were going to have someone do this particular movement? What is the first thing that you think about? What is the first thing that you cue? Is it some sort of cue to the torso in a way of getting a lot of the muscles to engage, and we're talking about stability, or are you first going to talk about the movement of the whole exercise, which is in the hip joint? For some people, it may not matter. You could say maintain your body position. You could even tell them to engage their abdominal muscles and then move their leg, and they would do it because they already can. So this is where looking at the client becomes really important. But if you prioritize the information you give, as we would then go on to something like side kick, right? Yes, there is a huge amount of stability in the body, but I'm going to talk about it as in maintaining. And then as I move my leg, I can notice, and I would expect, I think all the movers, as maybe if you're doing it now, the very first time you do a repetition of side kick, your body moves a little bit. If you all can do it without any movement at all on the first repetition, well, then you're a better man than I, Charlie Brown. I think we all go through those moments of organization. Oh, wow, okay, that's different. I need to do such and such today, because we're human and the body, it's not the same every day. So just think about those things as we're going, and how can we get a person to understand where the movement is happening, right? This is another great place to take the ball, the orange ball that I heard earlier, and just hold it gently behind the knee, because again, it will take the quad as a knee extender out of the equation a little bit, and we can focus a little bit more on what's happening in the body. And I had somebody write to me recently and ask me about side kick and the difference of maintaining the body absolutely straight on a diagonal versus coming into a little bit of a curve. For us in Polestar, we teach it both ways. I think it's important to be able to do both, just from a mastery of movement of, do I understand and know how to do this? This is going to help me when I go into a side plank, versus something like this, which may help me when I go to something like the side bend, the side plank, where we go into side bending, but from just the hand and the feet. So either one is good. Just have a reason why you're choosing it. All right, one of my faves, is the prone press up or prone extension. And again, think of the words that you say. So if your goal is to move your own body, your client's body, if you're doing it or teaching it, into thoracic extension, what does that really look like? What does that really feel like? And how do you describe it to your client? I would guess most people, and this is what I hear often, talk about lifting up. Nothing wrong with that. As you know, every cue, if it works, it was a good cue, right? So there are no real bad cues, but there are cues that are a little bit more descriptive and give me a picture as the student or the client or the patient, a little bit better idea of what I'm supposed to do. So as I'm going into the extension of my upper back, I don't necessarily want to talk about lifting, because that might be a little bit more of a straight feeling. So as I lift up and come down, I'm not really extending in my thoracic spine. I'm mostly just extending in my lumbar spine more. So lifting may not be the best way to go about it. And where I could get into the motion is the idea of changing the shape. And so this is where very helpful to have a skeleton that's mobile, that can move. A slinky, an origami spine. I didn't have it with me today to bring in. Just a bendy, like they have the long sticks that are rubber coated metal, and they bend and move. They have a name, I can't remember what it is. But whatever you can show that identifies making a longer position into a more curved position is really helpful, because then I have an idea of it. So one of my favorite ways to do this is not prone, but is actually supine over soft ball. You could use a Gertie ball. The Yamuna body rolling balls work well. a soccer ball is soft enough, anything that's there, and teach the movement in a different orientation to the movement that you want and a little different orientation to gravity. So if somebody can go into thoracic extension, they can go into thoracic extension here too. There's no reason why they can't. Again, I'm going to keep my arms up just so it doesn't block the movement. But I can now allow my spine to change shape over the ball and use gravity to assist me in doing this. This is probably one of the best ways to get people into upper back extension or thoracic extension that I really know of. Now, you might also, if you have a Pilates studio, you might be doing this over a spine corrector or an arc or something like that. A Bosu works well. Anything you can find that is curved that the body can just drape itself over. Once I have the mobility to do that, both thinking of the spine, the rib connections, and then also the soft tissue. I can imagine if you've been in this position for quite a while, right, at your computer, your phone, whatever you do, and then all of a sudden you're asked to stretch over something, the soft tissue is also going to have to kind of have more mobility, right? It's going to have to need more extensibility. So this is a really nice way to let gravity help with that. It's very simple. And then right away, go back to the prone position and ask the client or patient to recreate that motion. Think also again about not all the ribs move in the same direction. If I'm going to open a fan, if I was to get the slinky back up, or anything like pleats of an accordion, if it all moves in the same direction, there's no movement in between all of the pleats or the coils or the ribs. So have that idea of the ribs moving away from each other, right? To go into extension or flexion or side bending, rotation, whatever one. And you know that Brent calls that the rule of ribs. So that's our prone press up. And then quadruped, I just want to share this. There's lots of things in quadruped that we do. We do spine movement, we do arm and leg movement. Just a way to talk about and think about our spine movement, the cat and horse, cat and cow, cat and camel. I never can keep all of that doesn't all make sense to me. The angry cat does, or the stretching cat, but the rest of them I don't necessarily know what people are talking about. I hope it's not just me. The idea of matching what's already there, and also the idea of not necessarily focusing on or practicing the things we already do really well if there's something else that needs improvement, right? You can always keep practicing them. But if I have a lot of thoracic flexion already, I can do that pretty easily. I don't want to do my first spinal motion here of just increasing thoracic flexion because I have done 0 to my lower rib cage, my lower thoracic spine, and my lumbar spine. So prioritize it by maybe don't move the upper part of the back first. Start to move the lower ribs, the lower back, and the pelvis to match the existing curve in the thoracic spine. And then do the same thing going the other way. So if I start in extension, I don't need to practice lumbar extension. I can already do that quite well. I need to practice extension where I don't do it so readily. I might have the range of motion, but I may not know how to access it. So just think about it going in the upper spine first. And again, if I was going to do something bigger than this, I could extend everything more. But I want to at least give the parts that don't move in those different directions the time to move, and then I can move the rest of it. So just some things to think about on these common exercises that we give so quickly to people, like, okay, round your spine, arch, round, arch, good. Okay, bye, see you next time. But we're not really, I don't think we're really spending enough time teaching some of the nitty-gritty of it. All right, Natalia has a question. She says, if a client has a kyphotic posture, can I use the ball in supine for practice of extension? Such a great question. So if the client is kyphotic, but their spine still is mobile, they still have movement available to them, then it's okay. And maybe instead of using a small ball like this that could create quite a pronounced arch, maybe you use something like a regular gym ball, the exercise ball, or again, a spine corrector or something that has a less severe arc to it. It's more elongated. And see how they do with that, and make sure that the surface is somewhat soft and padded. It's not so much for comfort, but it's to allow the body to move where it has little potential of movement. So for that person, it's okay. If their posture is fixed, what would often is called a fixed kyphosis, as a non-physical therapist, I would probably not be giving them extension like that over a ball. If the spine is fixed in that position, that's probably not going to be safe for them. There are other ways. Even just lying supine is a bit of an opening and a lengthening for them. So just be mindful of that. Make sure also if you're working with somebody kyphotic, you're definitely propping the head up again, so that their head isn't just kind of hanging back in space. So those would be my suggestions there. But again, always go back to their physician or their physio if they have one, or if you have an in-house physio, double check and make sure, again, because we don't know how mobile people's spines are sometimes. So always good to just get that checked out. All right. And Lorna, hey, Lorna, is lying on the ball for thoracic extension to flexion safe for somebody with osteoporosis? So extension to neutral, definitely. And that is one of the things, again, if you're teaching classes and so many of the initial mat exercises are in flexion, use the ball. It's a great way to give people something to do. I feel so bad when clients go, oh, you have osteoporosis. Okay, well, just don't do this one. Like, are you kidding me? These people paid to be in your class. They need to do something. So this is the something that they can do. So they can definitely stretch over again, make sure that they're, ready for the exercises and ready to move. But otherwise they can move into extension and then come up into neutral. They could continue to do other different movements here. They could hold, they could breathe. And then when everybody else rolls down to the mat, they will roll over the ball. So they're getting mobility into extension and then mobility back up into neutral. So great question. I would not have them go into flexion from that point. Really trying to avoid flexion or loaded flexion. And because the ball, depending on the type of ball you're on, is soft, you can actually really push into flexion, which would not be safe. But extension and neutral is great. Yeah, that's a great one to do. So I hope that some of these ideas are helpful for you. And again, you may be teaching different exercises to people. Maybe you're teaching gyrokinesis work, or you're a personal trainer and you're doing some other different movements. It doesn't really matter what the exercise is. What's really important is to think about, if you were watching your clients, right? If you could see your clients doing the exercises at home, would you feel like you really prepared them to know what it is, what the goals are, and specifically for their body? How will they know? What internal feedback can we give to them? What piece of information that they can create internal feedback? We can't give them internal feedback, but what can they start to do to work on that so they know what they're doing? Is the information really clear? And what are the goals with it? How quickly are we pushing people out of their comfort zone in doing more challenging movements? We don't want people doing the same home exercises forever. As soon as they can do them well, keep changing, keep it interesting. We had a couple of questions come in, which is great. So I'm going to go to that now. So, oh, hi, Sarah. So regarding bridging, can you revisit again why a particular posterior tilt is not necessary when rolling up? Let me restate that. A posterior tilt is necessary. My question is, how much? Because people do from neutral, it's like from 0 to 60, right? In kilometers per hour, I don't know, 0 to a lot. They go from a neutral position into a massive amount of flexion and a posterior tilt. So now most of my hip muscles are active. They have gripped, right? The glutes have gripped. My abdominal muscles have probably shortened and gripped. And now I'm going to try to lift up, but all these muscles that are surrounding my torso are preventing me from actually having movement of my spine, which is the goal if we're doing this articulating bridge. So it's not that you're not doing a posterior tilt, it's just how much do you need to do? So think about inclining the pelvis some and keep going. And again, it's the idea of lifting the vertebra off of the mat. And this is going to answer Christine's question. I see her question next is about articulation. But when you're going into your bridge, tilt a little bit and then think about lifting the vertebra up one at a time, as opposed to rotating them backward, right? Or rotation is not the best word. If you're flexing more, right, really changing their orientation to gravity, they just tilt a little bit and lift. And that's all that needs to happen. It's not excessive. So good. I'm glad that was helpful. And it kind of leads into Christine's question, which is definitive research. Now, definitive research, I can't speak to that, but the question is about allowing somebody with osteoporosis to do an articulating bridge. And in my opinion, if you're doing it this way, yes, because you're almost not putting the spine into flexion. You're just, in the mildest way, you're lifting up. By the time you're up to the thoracic spine, if you're getting the pull of the pelvis toward the legs, you're not pressing back into the thorax. So it's actually okay. But you have to watch, how is the client doing it, right? So for me, it's okay. As long as they're not doing something that's putting their body into kind of a compressed flexion, but just lifting up and rolling back down in a gentle way should be fine for most clients. So thank you guys for that rash of questions right at the end. I really appreciate that. So we will wrap it up for today. Thank you so much for joining. I hope that the information has been helpful, and we look forward to seeing you at another Pilates hour in the future. Have a great day, everybody.